to show you a patient who's out about 3 to 4 months from a surgery we performed on her left foot. She had a lot of pain in her forefoot. She had IPKs and inflammation in her second, third, and fourth metatarsals. She had had previous surgeries performed on 2 occasions. One of those surgeries I performed myself years ago on her second metatarsal, where we performed a WOW procedure, WOW osteotomy. That caused a transfer lesion to her left third bone, and she had different surgeries by other doctors in the process. But what we were able to do is see her some years later, and now we got her foot back more normal again. What we did this time, instead of traditional procedures, we did minimally invasive surgery. And what we did to even her foot out, she had an implant performed by another doctor in the first MPJ, so that transferred even more pressure to her foot. So she developed a lot of IPK in the forefoot. So what we did minimally invasive surgery this time, and we performed an Achilles tendon lengthening on the back of her leg, which got some pictures. We have pictures of that, where we performed an ATL percutaneously, and in her forefoot, to get rid of all these chronic IPKs, we performed at the top of her foot here. This time we did percutaneous metatarsal osteotomies. Now, one of the advantages of minimally invasive surgery when it comes to metatarsals, you can do more than one. You can do second, third, or second, third, and fourth. And these metatarsals find their normal attitude and takes pressure off the foot. The reason we didn't have complete resolve before, when we did the WOW osteotomy to her second metatarsal, which was years ago, she had an IPK here, it just transferred it to the second and third, or third and fourth. So now, after all this time, we finally got her foot better. She's gone through a lot of issues, multiple surgeons, and including multiple trials in different ways, minimally invasive surgery and traditional procedures. Now, through a simple minimally invasive surgery we did in the office, which included an ATL percutaneously and metatarsal osteotomies percutaneously, she's now a lot better. Before the surgery, how from 10 being real bad pain and 1 being no pain, what was your pain on a daily basis before the surgery?
No, at least 8 to 9.
8 to 9, she says.
Yes.
And now, I know you've had a lot of different surgeries, but now, what is your pain in your foot now?
Well, it's very minimal now.
Very minimal, okay.
The most prominent thing right now is all the swelling is still there.
Yeah,
it's hard to get shoes on.
Right. So what she's saying is the pain is pretty much gone, but she's got some swelling. That's because the secondary bone healing is still taking place. But anyway, we got her a lot better, and this is now 4 months after the redo where we did it minimally invasive. We got her a lot better. So minimally invasive surgery is also a good way to redo things that don't go as well.
Yes, I wish I had come back before now.
Yeah, so what she's saying, she wished she'd come back to me for the second one, because the surgery she went through after I saw her years ago were kind of pretty bad for her, and it just made her foot worse and worse. By putting the implant in, that transferred more weight to her midfoot. So all the surgery she had to try to fix the first issues just made her foot worse. Would you agree with that? Just made things worse. So really, minimally invasive surgery, wish we'd have done it. I don't think I even did minimally invasive surgery back when I did her foot the first time. We could have gotten her better years ago, but we'd have had those in our arsenal back then.